One of the long bones that form the appendicular skeleton and is slightly curved longitudinally is the radius, hence its Latin name meaning stake or staff. This bone, along with the ulna, is located on the forearm and articulates with the humerus, ulna, and carpals. The radius lies lateral to the ulna when the palm is facing up in anatomical position or supination, and crosses over the ulna when the palm is facing down in pronation. This pivoting motion in which the radius rotates around the ulna is why the radius plays an important role in the position of the hand. The head and neck of the radius are at the proximal end, as well as the radial tuberosity, which is on the anterior side. The head of the radius articulates with the capitulum of the humerus. This contributes to the elbow joint. The head also articulates with the radial notch of the ulna. The head helps the forearm pivot and flex at the joint of the elbow. This site also serves the proximal radio-ulnar joint, which is responsible for pronation and supination. The radial tuberosity is inferior to the head and neck of the radius. This is the insertion point for the important muscle used for lifting, the biceps brachii. The interosseous border is a ridge on the medial side of the radius. This border serves as an attachment site for fibrous connective tissue called the interosseous membrane. The interosseous membrane connects and transfers forces between the radius and ulna. This membrane also serves as an attachment site for forearm muscles. The forearm muscles that are attached to the interosseous membrane are the extensor pollicis longus, extensor pollicis brevis, extensor pollicis indicis, abductor pollicis longus, flexor pollicis longus, flexor digitorum profundus, and pronator quadratus. These muscles are important in the movement of the palm as well as the phalanges. The styloid process, the ulnar notch, and a facet for carpal bone articulation are at the distal end of the radius. The styloid process is a projection on the lateral side of the radius. Attaching at the styloid process is the lateral radial collateral ligament and the brachioradialis muscle. The brachioradialis acts in supination and pronation, stabilizes the elbow, and is synergistic to the biceps brachii. The concave ulnar notch of the distal end of the radius articulates with the head of the ulna as well as the lunate carpal bone. The ulnar notch joins with the ulna and forms the distal radio-ulnar joint, which is a pivot joint similar to the proximal radio-ulnar joint. Next to the ulnar notch is the facet for articulation with another carpal bone, the scaphoid bone. The radius is the most commonly broken arm bone. This may be because of its proximity to the carpal bones, since its most common fracture, the distal radius fracture, being caused by landing on an outstretched hand. About 250,000 wrist fractures are also due to osteoporosis. A broken radius will hinder one's ability to perform regular activities involving the arm and hand range of motion. This shows the significance of the radius, which is also evident in all of the radius's articulations.